Here's a question. Can extreme weather changes impact your mental health? It appears climate change and other natural disasters can actually impact your mental well-being. Joining us this morning to explore this intriguing subject is Hartford HealthCare's Dr. Newfield, Chair of Psychiatry at St. Vincent's Medical Center. Doctor, thanks so much for your time this morning.
Thanks so much, Alyssa. Good to be with you.
Absolutely. So what is the American Psychiatric Association saying about climate change in regards to mental health?
Well, the APA highlights that climate change has a real impact on mental health outcomes. Anxiety, depression, post-traumatic stress disorder, otherwise known as PTSD, are associated with severe climate-related events. Additionally, domestic violence and aggressive behavior have unfortunately also been demonstrated to increase with severe events as well.
Pretty interesting. How does climate change impact us?
I'd like to be clear that climate change is an ongoing progressive process, and it's really the extreme weather events associated with that process that the APA is really honing in on as affecting people's mental health. So just as with any life-threatening or significantly traumatic episode, these extreme weather events can affect one's mood and anxiety, and that causes interruptions in one's ability to maintain functioning.
Absolutely. So Dr. Newfield, are you saying that those struggling with mental health maybe already are likely to be more affected by this?
For sure. Traumatic episodes like severe weather events can result in resilience reactions in which people rise to the occasion and overcome adversity. But unfortunately, a certain large percentage will struggle. And those suffering from mental illness are among society's most vulnerable. So they will be challenged to continue getting supports that they rely on, like mental health care and medications. And therefore, maintaining basic needs such as employment and housing and nutrition will be all the more difficult for the mentally ill.
And you personally, do you have patients who are dealing with this? Is this something you're seeing right here in Connecticut?
Not so much. I was employed at Bellevue Hospital in Manhattan when Hurricane Sandy forced the closure for 3 months. And during that event, I was deployed to shelters where residents were evacuated from community programs. And I saw patients challenged with the displacement and other aspects of the disaster. And right now, people around the country with Hurricane Ida in Louisiana and wildfires out in California are having those events. But luckily for us, recently the weather hasn't affected us to that degree.
Absolutely. Is there anything that you recommend people do to get ahead of it or maybe calm their anxiety, really strengthening their mental well-being in regards to all of this?
Yeah, I think it should be helpful for them to know and to calm them down that we in the medical community are doing all we can to strengthen the mental health care systems and improve people's ability to access mental health care. And I'm a huge fan on an individual basis of people's discussing mental wellness and being more open to reducing stigma in a way to get and accept the help that's needed.
Absolutely. Dr. Newfield with St. Vincent's Medical Center, thank you so much for your time this morning.
Thank you, Alyssa.